Alfie here once again at Vente Pain Relief Clinic with another one of my helpful tips for you guys. So today we're going to talk a bit about something called Piriformis syndrome. Many of you guys may be suffering from it, may have heard of it from friends. A lot of runners may be suffering from this type of dysfunction. So the piriformis, as you can see here, we're using Skelly again as the model, is a very small muscle that lies deep in the glute. What it does is it turns your leg outwards. It's a lateral rotator. It also helps with extending, such as like when you're sprinting and you're pulling your leg back. It does a little bit of that. This muscle is small, but it can cause a lot of issues, and we're going to talk about that in a little bit. So I'm going to just bring Skelly over here. You can see the red tape that I marked there. This is a model, a rough model of the piriformis muscle. As you can see, this gray thing here, this is a model of the sciatic nerve. Now, what happens sometimes is that the piriformis muscle can actually become super tight. It can become very tight, and because of where the sciatic nerve lies, most times underneath the muscle, it can be pressed on by the piriformis muscle, basically aggravating that nerve, causing pain, numbness and tingling going down the leg. It can cause local pain in the area, so the person might feel like they have this pain in their butt, literally, and also pain down the leg. So what are some of the potential causes of this piriformis syndrome? It could be that you're sleeping on one side where you're flipping one leg over constantly. That'll basically make that piriformis muscle more taut. The other thing too that's very common is just sitting for prolonged periods. This muscle can get very tight that way. If you're doing a lot of running on uneven surfaces, potentially the piriformis can get very tight. Also, if you're running on inclines, that can also cause some of the piriformis type of symptoms that I mentioned earlier. So if you're getting symptoms where, for example, you're going up and down stairs and you're getting pain in the glute, maybe pain down the leg as you're walking up and down the stairs, it could be the piriformis that's causing the issue. A lot of times it mimics real sciatica. This is what they call pseudo-sciatica, in that it's not pure sciatica, whereas pure sciatica actually comes from the lower back, the lumbar spine. This is coming from the glute, but it can mimic those symptoms. So, you might go to the doctor says, oh, you have sciatica, but it may not actually be the whole story. It might be that the sciatic nerve is pressed by the piriformis muscle and not necessarily coming from the lower back. This is treatable for sure. Basically, as a therapist, what I would do is I'd relax the piriformis muscle. We'd look at your activities, maybe your behaviors at work that could be tightening this muscle up. So this is the piriformis muscle. If you're noticing those symptoms that I mentioned, you might want to give us a call. If you've got questions regarding this, feel free to call us at 416-644-8894 or email us at admin@ventepainrelief.ca. And just remember, every Monday at 5:30 we have these little premieres to help you with your wellness. Have yourself a great day and take care.